What are your thoughts and opinions on the patients that come in that'll have a common cold or the flu and then stacked with maybe sinus infection? So pretty much that they're ending up with those recurrent infections and then they end up thinking that there might be something wrong with them, that they're constantly sick, that they never have that break and feel healthy and like themselves.
Two issues there. I think one is that whole issue of, is there a possibility of a bacterial infection forming on top of a viral infection? Again, we're going to look for symptoms. We're going to look for very specific indicators that suggest, yes, this may have transitioned from a viral to a bacterial illness. And that's not to say that everything that somebody presents with is only going to be viral. There's lots of first case of bacterial issues. But I think the people that end up in a recurrent nature, like with a recurrent cold or a recurrent flu, or then have got COVID on top of that, and then gotten another cold, the question we have to ask at that point, and we kind of ask ourselves, is this an individual who tends to be in a situation where this may be happening more often on a natural basis? Classic example. One of the most prolific times of an adult's life of getting colds and flus is when they have kids between age 0 and 6. We know that that's an actual thing. And why? Because their children tend to manage to give them lots of additional things besides hugs and loves and care that might not be as much desired as those other things. Some people tend to have tendencies to self-infecting themselves by recurrent touching of surfaces, or just sort of a hygiene approach. And that doesn't mean they're not taking care of themselves, but they don't realize that making contact with the surface and then making contact with the mucous membranes on your face is actually a great way of causing or transmitting an infection. And so that's super important. Now, there are cases as well when a patient may have lots of other comorbidities, illnesses that may predispose them to possible infections. And yes, that's worthy of a discussion. But I think it's also as worthy to say, or have a person self-reflect, am I doing this to myself? Or is this situational because of I have kids, or I'm in an environment, or God forbid, I'm a healthcare worker, and that puts me immediately in that area, and I'm at risk.
I think there's probably a need to also clarify bacterial versus viral. To the average person, how would you distinguish the two?
It's not always cut and dry, and it's not always easy. Admittedly, that's the case. We look and ask lots of questions on different possible contributing factors to their symptoms. I raised the issue of having had kids, and if you have 3 kids in the house and they all have colds, and you now all of a sudden present with cold symptoms, it's not an unreasonable conclusion to draw to say this is likely a cold. You're probably getting it from one of these sources, if not all of them. There you go. But if you're completely isolated and you've not been around anybody and nobody else, then I think it's worthy then of other considerations like a bacterial type infection.